There we go. All right, I think we're recording. Great, so welcome everybody. This is the Data Hub 101 session, your guide to getting started. It is a brief introductory session where we're going to cover some Data Hub basics, share some tips and best practices, and run through some examples. And I just wanted to first introduce ourselves. I am Kawai Tanabe. I am the Senior Data Analytics Specialist at ACHA. And Mary, if you want to
Hi,
introduce yourself.
hi all. I'm Mary Hoban. I'm the Chief Research Officer at ACHA, and happy to be here with you today.
And even though there are a lot of people, we were kind of going to keep this more of an informal session. So please feel free to ask questions at any time, either by putting it in the chat, raising your hand, unmuting yourself. And we'd be happy to answer that. We also have a dedicated section where we'll have a question and answer period. So you can always save your questions for then.
And Kauai, you and I will help each other by I can't talk and read at the same time.
Yeah,
I'll read chat while you're talking and vice versa.
perfect. Thank you. Um, all right, so our agenda today, we'll briefly review the homepage of the Data Hub. Next, I'm going to walk you through some IPS reports, while Mary will walk us through some NCHA reports. And I guess instead of using acronyms, I should kind of spell it out. IPS is Institutional Profile Survey, and NCHA is the National College Health Assessment Survey. And we also obviously want to hear from you to see if we can answer any of your questions that you have about the Data Hub. And then we'll finish by sharing some upcoming features we have planned for the Data Hub, as well as additional help and training sessions. So now I gotta stop sharing for a second so I can share my other screen to get us started in the Data Hub. All right, great. So now I'm gonna kind of be looking over to the side, but so this is the main page of the Data Hub. Once you get your access and you're logged in, which we recommend bookmarking this page so you can easily find it when you need it. And this is the main page that you will get to. And this page is really just an opportunity to show you that there's additional helpful links for navigation guides, which I won't go through each one of these, but you can click through these and the image on the right will explain to you what each of these things are.
I'm sorry,
And yeah.
Kauai. I just admitted like 100 more people.
Great.
Maybe next time we do sign up so we are better prepared for this.
Yeah, I think so. Yeah, that's great.
Sorry.
And now you're good. Um, all right, so this is the homepage. And again, or not again, but I've actually am working on our test site just because that way I can show you if I had an institution, how that institutional data will show up for you. So don't mind that it says test up here. These are additional links that you can look at. The data dictionary is a helpful place for when you kind of get into more the create your own reports section, but these are the data sources that we use currently in the Data Hub. And this main blue navigation panel over here is where all of your information, where you're going to want to start. So while I think you guys can kind of explore this homepage yourself, I'm going to walk through some of the pre-designed IPS reports. And a lot of buzz lately has been around electronic health records, just with the merger of Medicat and I can't remember now what the other one, who they merged with. But we do have a EHR system pre-designed report pre-developed for you. And here you'll see that you can choose between two chart views. Mainly the difference being that starting in academic year 21-22 in the IPS, we started to ask this EHR question separately for medical and mental health. Prior to that, the question was a select all that apply, and we couldn't differentiate between medical and mental. So most likely this chart view will be the more helpful. You can choose from those academic years here, again, from 21-22 onwards. And then up here, you can choose, sorry, maybe I should make this a little bigger so y'all can see. You can choose between your medical EHR as well as mental health. So you can see by clicking through them for mental health, titanium was the #1 EHR used by most of our institutions that participated in the IPS for academic year 23-24, while for medical, it was Medicat. We do provide a table down below where you can see that the total institutions who participated in the IPS in academic year 23-24 was 207, and these are the counts for each of those EHR systems. If you wanted to add additional filters, we have 3 filters built here where you could select from your region. So say I am a school in the South, I'm a public institution, and I have 20,000 plus students. Then these charts, as well as these tables, will automatically filter down to schools of your similar size or whatever filters you decided to apply here. If you forget which filters you've applied, you can always hover over this filtered applied, and it'll show you which filters you've applied. Additionally, we've provided some wording up here that says 3 institutional filters applied, just so if you do take a screenshot of this, you realize that there are institutional filters that are applied here, likewise in the table. More generally, if you wanted to export this page, you would click on this export and you have the ability to export it into a PowerPoint or a PDF. You can also, if you hover over these charts, additional options appear. You can click focus so you can see it bigger. You can also copy your image as, or copy this chart as an image, which I'm not going to do because that's going to take a bit. If you wanted to download this table, you could click on these more options and you can click on export data, and that will export this table as an Excel file. So lots you can do here. Another very important thing that we've provided is in this bottom section here, it gives you a little bit more information about each report. So if there's a read more hyperlink, you could click that and more information will pop up. Again, here it'll just tell you that prior to 21-22, the questions were select all that apply. So we encourage you to definitely look at that read more section of these charts. Another report that is pretty popular, I would say, is the health services expenditures. And sorry, if I'm going too fast again, please feel free to interrupt. The health expenditure chart, or the report here, we've provided 2 separate charts. One looks at the median expenditures per eligible student, which are the unique number of students eligible to use clinical services at your center. And that is a question in the IPS. So if your institution did not provide that number, then the orange, which is referencing my institution's data, will not appear, versus the enrolled students, which are the number of unique students enrolled at your institution, and that we pull from IPEDS. So everybody should have enrolled student data here. So as I mentioned, the blue bars are the reference group, which means all institutions that participated in the IPS for that academic year, while the orange bars will be your institution's data. Um, and I have it on 2018, 2019, just because that was the year my institution participated. If my institution didn't participate or didn't provide figures for that academic year, you'll only see these blue bars here. Down below in each of the charts, again, we have the mean values, the median values, standard deviation, the minimum, maximum count, and total institutions. The difference here is the total institutions are the count of everybody who participated in the IPS for that academic year, while the count is the number who answered the question. So for medical services, there were more institutions than institutions who had health promotion costs. So that's the difference between the count and the total institutions. If you were to apply filters again, so say my South public 20,000 students, then the total institutions become those who fit your filter criteria, and then the count is within those 13, how many of those answered those questions. So when you're looking at any of the data in these reports, just be mindful of the total count and the total institutions, just so you know what you're looking at.
Can I add here that, you'll
Mhm.
recognize some of these ends are pretty small when you start adding filters, and that's a function of the total N for that particular year being at 236. Like, just imagine how much more powerful this could be if even more institutions, it's our hope that eventually all ACHA member institutions, what if we got data from 700 schools instead of now we're at almost 300? It's going to be even more powerful. So seeing this many people interested in the topic today gives me hope that we're moving in the right direction.
Definitely. And I guess I didn't mention at the beginning, but the IPS reports are where we started Data Hub. And so this
Mm.
is kind of our initial attempt at creating reports. And so as you'll see when Mary walks us through the pre-designed NCHA reports, is that we've gotten better at this. And so we will be going back to make sure that these reports are more in line with NCHA pre-designed reports. And so right now, one of the major things being we only have 3 filters right here. As you'll see in the create your own section, we've added additional institutional filters, which then leads me to another report, which is median FTEs. Again, we provide it per 1,000 eligible students and per 1,000 enrolled students. So I won't really go into too much detail on this chart, except to say that these median FTEs, we've actually collapsed all the individual FTEs that you report in the IPS and have categorized them into these staffing groups. And you might ask, well, who belongs in each of these groups? That would be in this read more pop-up, where we tell you who we put into each of these categories. But if you're like, but I really only want to know like the psychiatry, a psychiatrist, what FTE do they, are institutions employing? For that, we'd have to go to the create your own IPS section, and it's a numeric value. So we're going to go to the numeric. And here we have to open the question tab by, I'll show you again, this filter panel button here. You click that,
You'll
and then
you'll
you have,
notice when she went in, there was already a chart showing. It's because it's the last one she had been at, and as you use Data Hub, you'll see the same thing. You got to start
exactly.
over again then.
So here you can narrow down your questions that appear in this dropdown, which is a long list, by selecting themes, which you'll find in the data dictionary, or you could just type in a keyword here. So I'm going to type in psychiatry or start to, and then I see the FT mental health staff position psychiatry. So I'm going to select that. You have the ability to cross it with a second question, but today, or for right now, I'm not going to. Here you'll see that we've added a few more institutional filters. So we have region, ACHA affiliate, campus setting, urban, suburban, town, rural, institution type we had, enrollment size, institution level if you're a 2-year or 4-year school, if you want to look by Carnegie classification, or whether or not a school is religiously affiliated. We also have some additional information over here if you want to see the mean, the median, the min, max, and then the count institutions, my institutions. If you select it, it'll turn black. If you unselect it, it will turn white. And then you can select from any of these visualizations. In general, I find this column chart to be the most useful. And so if you click on that, then it will generate a report. And this is showing, I didn't deselect any of the academic years. And so it's showing all academic years. So trend over time of physicians who are part of psychiatry. The orange bars are my institution. The blue bars are the reference group or all the other institutions. By hovering on the chart, it'll show you more information. And then this blue box over here will show you if you've applied any filters. Right now I haven't, it's just showing me that the question I selected is here. But if you wanted to add additional filters, you could go back to this filter panel and select all of the same filters. And maybe I want to look at 4-year institutions. And then you'll see, I don't know if you saw, but there is a little dial thing that just tells you that the data is refreshing. And so this is the result of my filters being added, and the summary of your filters are over here on the right-hand side.
Notice here, because she added so many filters, what was this? Public 4-year institutions in the South of 20,000 to 30,000 students. The N's are pretty small in that table. If it says NA, it means it's a number less than
The
5.
minimum sample.
Yeah, we do that to protect, should a campus be identifiable by a combination of demographics, we do that to protect the identity of those schools.
So that is where I was going to hand it off to you, Mary. So I'm going
Okay.
to stop share,
Well,
hand it over to you.
I'm going to encourage you. I am still admitting people, so I would encourage you to
I will keep an eye on that.
keep an
Thank
eye
you.
on that. Haven't seen anything in the chat yet, which is fine. Okay, I'm gonna take you guys through some of the NC. Oh, what? I want you to see all my emails. Actually, there we go. Thought I had that up. You're looking at my Data Hub menu now, is that right? Or my Data Hub page? Okay. Um, the piece I'm going to share with you, we really have 3 main units right now, though we're excited about what's coming in the next few months, hopefully. Kawhi showed you the pre-designed IPS reports and a little bit of the create your own report. I'm going to show you some of what we've done in the NCHA pre-designed reports. The whole purpose of the pre-designed reports are, first of all, to give folks a quick link to things that they may need with frequency, but also things that would be difficult to create in the create your own module. Um, we're able to group a number of visualizations into one report to hopefully help you tell a story. Um, so these are just some things that we started with from the feedback given to us by our leadership team. And you can see there's 8 pre-designed reports here available for NCHA data. And I'm going to start with academic performance because now the first thing you're going to notice is this looks really different, a little cleaner than the IPS pre-designed reports that Kawhi showed you. It's because the IPS stuff was created first. We got smarter, we came up with a better design, and so the NCHA stuff looks a little bit better. Wait till you see the stuff we're working on now, because it's even cooler and easier to use. So a couple things I want to show you about this is an example where we took a lot of variables into one report. This is not something you could do in the create your own NCHA module once that becomes available. Um, so you can, and it's set right now to single survey period. I'm going to pick a different one. Oh, down here. That's weird. Thought I had local data. That's all right. Um, I I'm logged in as a dummy school that I was pretty sure had data in spring 22 and spring 24. But just pretend next to every one of these blue bars. I'm sorry, this isn't going to work. Let me do this. Go over into the test environment. I think it might. Best laid plans. Bingo. All right. This is what it's going to look like if you are using these pre-designed reports and it's a survey period that your institution collected data. We try to go with the color theme of blue is reference group, orange is your local data. You can see, if you're familiar with the NCHA, you'll know that it pulls academic impediments from lots of different places in the survey. And in this one report, we try to pull all that together. They are organized into 3 big groups: the problems or challenges, the acute or chronic conditions, and then other impediments. And within those, if I drop this down, I can actually select different things that I want to see. This shows all of them. The other thing that's you can't do and create your own that we can do here is that, and if you've worked with NCHA data before, look at our reference group documents, you'll know that we sometimes play with denominators to show you something a little bit different. And that's exactly what this impacted students piece means. If you look at the figures that we're presenting here are out of all students that took the survey. That this is the proportion that that reported that a problem with the problem with hazing impacted their academic performance. So in this case, it's 1% of your data overall. But the other thing you can do is isolate just impacted students. So the students who told us they experienced cyberbullying or hazing or whatever it might be. And then we asked them whether or not those issues impacted their academic performance. So that you can see both among your whole student population, what proportion that is. Take a look, notice bullying here that, and I already mentioned hazing. If you notice I'm sorry, you can't see that. Um, if I change that to the impacted students, look what happens to those numbers. If you recall, hazing was 1% of your students, but of the students who are hazed, more than a third of them will tell you it's impacted their academic performance. Look at bullying. Very few of your overall students report bullying, but a full half of them who do experience it are reporting that it's negatively impacting their academic performance. So this one it gives you the opportunity to look at them both ways. People often ask me, well, which number's right? Well, they're both right. They're telling you two different things. Like the reports that Kawhi showed you, you've got a read more section down here, and explains the difference between the all students sample and the impacted students. It tells you where the questions are being pulled from. You've got the chart that you can export here if you like. You can export any piece of this or the entire slide if you like. Um, so there's lots and lots of uses. When you go to the trends piece of it, you need to, because we're showing multiple periods across the bottom here, you need to select a single issue. And this default just defaults to alcohol. You can, again, this is and defaults to your all student sample. If you wanted to isolate your impacted students, so the students who had a problem or challenge with reported a problem or challenge with alcohol, those numbers go up a little bit among that population who reported the problem or challenge that indicate a academic impediment. Um, this is different. I showed you the bullying one previously. Um, this is what it looks like over time for this school. Uh, it's pretty stable, both in the reference group and for that campus, as well as when you look at the overall students over time. Um, the next thing I'd like to show you is this one on mental health and well-being assessment scores. Again, we pulled a lot of variables into one place in an attempt to help you tell a story. This is looking at a single survey period. It's showing all of these things over time for all of your students. Um, again, blue is the reference group. Orange is your campus data. Looks like in this case, at this particular campus, the figure's a tiny bit lower for the Kessler 6 scale. Number of more students indicate loneliness. And this one's kind of interesting. There's a big difference there here between students screening positive on the suicidal screening. Same, and it kind of correlates with this one down here. You also have considerably fewer students attempting suicide. And what you'll find down here, for some of these that are scored, you'll see the um, median scores here, as well as for the reference group. I'll give you a little bit more information there. Again, the read more section. Let me show you some filters here. If I wanted to drill down and let's look at just queer spectrum students, and that collapses essentially all sexual orientation other than heterosexual. So any students in those spectrum of responses. Um, and you can see here that the number shifted a little bit. Take a look. The scores change here, and the total number of students change too. In your sample, it's more like, or in the school sample, it's more like 70 students, and it took the reference group for spring 24 down to 28,000 students. Again, you can add as many of those filters as you want. The other thing you can do, because it's NCHA data, you can filter by both institutional characteristics as well as student characteristics. Um, and uh, Take a look at how that might change. The more filters you apply, the smaller the numbers get, may not be as meaningful to you. I really encourage people when you're playing with those filters, go ahead and put in everything you want to know. But if you're looking at sample sizes that are not really giving you enough power to understand what you're trying to understand, then start subtracting and pulling that sample size up so that maybe you can make some better conclusions based on those sample sizes. Um, One thing that's coming in the future is we will be adding an institutional variable for graduation rate. I know that's important to a lot of schools in measuring student success. Um, Check the time and let me show you food insecurity. Maybe I should have started with food insecurity. It's more straightforward. I'm basically showing you one thing on this report, but let me see, there's no filters applied. So this is everybody in the sample. This school had a pretty small sample, 251 students compared to 68,000 in the reference group for spring. Let me look at spring 24 is a bigger group. There, I added that as well. You can see both the school sample and the reference group sample size increase there. Again, this is just a quick look at how your school compares. These very low food security and low food security are highlighted in green because they are combined in what you see above, that these figures are combining those two. If you wanted to use the data differently, you could pull this, pop out the data table here, copy it into an Excel file, and create your own visualization if you wanted to play with it in a different way. Kawhi, am I missing anything you would have
Nope, I think that was
covered
great.
here?
I think that was most of what I would have covered as well.
Okay, I'm going to stop sharing.
Um,
We'll go back to the PowerPoint.
yes.
Oh, lots of questions.
Yeah. Um,
You guys were
um,
smart to wait for Kawhi to answer your questions.
not true. All right. So I guess the next thing I had on my agenda was questions, but maybe I'll go through some of the upcoming stuff and training, and then we'll kind of finish with the questions if that would work. So some upcoming features in the next few months or throughout this year is we are hoping to get out to you all, create your own NCHA reports. So I showed you a little bit about create your own IPS reports. The create your own NCHA reports will be a little easier to follow and get your questions, and the chart itself will actually look much nicer than what we have right now in CYO IPS. So that's coming out probably first, and then followed by create your own IPS and NCHA combo reports, where you will be able to compare one IPS question with an NCHA question. So like a policy question from IPS with a student behavior from NCHA. So we think that will be very powerful. And then we have the create your own IPS report version 2, which will look like the create your own NCHA reports, where it'll just have a nicer layout, and you'll be able to do more with that version than you can in this current version. But as we mentioned, this was kind of where we started, so we're learning as we go as well as to what works and what would be useful for you all. And then additional help and training sessions. So as these CYO reports become available, we'll do additional training sessions specific to each of those reports. We might need some extra time for those just because there's probably a little bit more to discuss. And then we're considering having some monthly Zoom drop-in sessions where I can be available to answer any specific questions that you might have. We also encourage you to post any of your questions and connect so you can all help each other or share what you've learned or discovered in Data Hub. And that also gets it out to other people who might be curious about Data Hub but don't really know what's in there. And then you can always contact me and I'm happy to schedule a one-on-one meeting or just talk to you over the phone or help you navigate to a specific report. So feel free to contact me anytime with that. Um, Anything else, Mary, to add to either
Well,
of
I'm
those?
I'm looking at the chat and it looks like we're getting a lot of questions like, hey, what I'm looking at doesn't look like what
Mm,
you guys are seeing. And it looks like your advice there is refreshing. And you know what? I should have done that when I didn't see my local data immediately. A lot of times that's the answer is refreshing the browser and refreshing from within Power BI. And if you're still having trouble, let us know. I'm excited by, I never thought we'd have 100 people
yeah,
today. I want to let's get those drop-in time scheduled this afternoon and get them posted because it is helpful when um, we if we can get these questions answered and do it in a all at one time, that's terrific. We're also taking good notes and paying attention to what may need to move into an FAQ document. That you're not the only ones with these questions. Um,
um, and we just had a question, when can we anticipate 24, 25 data upload? That should be available in early April. Um, and that will be, we will make an announcement. We'll also, on the main Data Hub page in the alerts box, I guess I could share that. We post it there as well. So if you just so happen to be in Data Hub and you hadn't seen the announcement, then it will be posted there as well. And this is the alert box that I'm talking about. So the most recent one will always be at the top, but if you wanted to see any of the past ones, you can also go back and look at the past alerts.
I'm kind of curious. Kawhi and I had this conversation recently about should we maybe start a Connect community for Data Hub users? The success of any of those communities are about how active they are, but I'm curious if any of you have thoughts about that, or if that's something you think you might like to participate in and just be a feed specifically directed to these kinds of questions. Amen, Karen. Um, Fair. Um, we got that other question answered, right? About the budget question. And
Oh,
we've
sorry, did
got
I miss
we've
something?
got a little time if folks want to, as we showed you some things we thought you'd be interested in. If you've got some specific questions, um, either one of us would be happy to walk through and see if we can answer them or see what we can find in Data Hub. if you've got some examples for us. Sorry, Kawhi, that was not pre-planned.
No, that's fine. I was just wondering, I don't know that I see the budget question in the chat.
Oh,
Um,
it's I'm no, I'm thinking about the one that came in via email that we talked to Sarah about that wanted to look at
oh,
proportion of the it was a revenue, insurance revenue compared to the as a proportion of overall revenue.
sure.
Um, there's questions about adding and to kind of get back to some of the basics. Each campus that participates in the IPS is entitled to two free licenses. We have to purchase individual Power BI licenses in our system for folks to use it. And the RMI or the representative of the member institution is who kind of determines who on campus has that access. Um, there are additional licenses available for purchase if and plenty of schools have more than two people and we can get you the information on uh, purchasing additional licenses. Um, we will Helen had a question about adding other people.
Mhm.
Kawhi will reach out with an email. There's a form the RMI needs to submit and we'll take care of it. um Yolanda's having trouble getting access at NCA&T. We'll work with you, Yolanda, to try to get that figured out.
Yeah. So I think one of the questions that we received was related to, I think it was for insurance collections.
Yeah, the member had a question about I guess they're considering billing insurance and wondered if they could find in Data Hub what proportion um, insurance revenue was as part of the overall revenue. And one of our limitations is that the question actually isn't just about insurance collections. It's all fee for service, self-pay, and insurance. So it's collapsed. Um, and so you can see that in this report, where we just selected that one item to then my suggestion would be you run the second report that looks at total revenue to get your second figure. And then your good old fashioned math skills come into play. And you've got your numerator and denominator and can answer that question. Um, what proportion of overall revenue um, for schools is that insurance piece making up?
And again, you can export these as tables, and so that would make that calculation a little
Good
easier
point. You don't have to
if you
even do
wanted
the
to.
math. Let Excel do it for you.
Yeah.
Anything
Um,
specific you'd like us to show you? Don't be shy.
Yep, happy to show you anything or answer any other
Hmm.
questions.
More filters. Um, the question came
So
in
is this,
about adding more filters, such as like a student having a disability. Um, we're always thinking about more. And I'll tell you quite honestly, it's an expensive program and every little thing we add costs more money. And we are uh, looking at ways to reduce those costs, but absolutely taking suggestions for things we can do to enhance and add some new stuff. Actually, you know what? Once Create Your Own NCHA is available, you'll be able to compare two questions. And if one of those is disability status, in some ways that second question can act as a filter. So once we have that, because it's a question on the survey itself. So, no, you absolutely should be able to see your institution's data in the pre-designed IPS reports if your institution did the IPS that survey period.
And just to tag on to that, it would currently only be for the numeric questions where you'll see your data side by side. But if it's a policy question, then your response is not like it's not shown separately. Um, I think the thought was that you would maybe already know your institution's policy. And so we thought, okay, well, if your tobacco policy is there's no smoking available anywhere, you're just looking at the comparison of the reference group. But I think as we started to build NCHA, we realized that, well, maybe that is something that users want to see. And we've discussed that with our committee. So we are looking into that as well. But most of the, or all of the NCHA reports will have your institution's data for the survey periods that you participated in.
Leah, bring that question back to us when we do the training for NCHA CYO. We'll show you how to do it in that session. If you're wondering about the next IPS, I mean, IPS is ticket to everything. It really forms the foundation of everything we build on in Data Hub. And if know that right now we are working on revisions to the next IPS that'll collect data for the academic year we're in right now. So for the 25-26 academic year, we're looking to see about modifications we might need to make. We're going to swap out the rotating piece of that we asked last time on integrated care is going to come out. It's going to be replaced by some more in-depth questions on sexual health services. The following year, we anticipate in-depth questions on student health insurance policies, kind of replacing that periodic benchmarking survey. We expect that that will go out right after Labor Day. Our goal is always to have it released to the membership with the start of a fall semester. And then it's due December 31st. And you would be surprised how many we get on December 31st. The invitation is either going to go to your RMI or to the person designated in your institutional profile as the person who should get survey requests from our office. I would encourage you to have these conversations on campus. I would suggest the IPS is complicated and it's long, and we do a good job of the hardest one. The first one's always the hardest because after that we pre-populate your answers and you're just updating it in the second or in the next iteration. However, the information comes from all over the campus. We're trying to get a picture of that whole environment. It's not something likely that a single person on campus will be able to answer every question. And that's why we encourage you really to get in there early, start looking at the questions, kind of start dividing them up. Somebody's got to coordinate it. Somebody's got to sit down and enter the actual data for us. But that's why we give you a worksheet so that you can work from that before you get into the survey and kind of spread out to all the places on campus that you might need help in answering that question or any of those questions. So I really hope I hear from people like, well, that's weird. I didn't even know my campus did the IPS. Nobody asked me about these questions. And I'm really hoping the more we're talking about it and the more people are learning about it beyond the directors or the RMIs, that you guys are having internal conversations and asking your directors, if you're not that person, like, hey, what's going on with this? I'd like to help you with it. This is important data for us, to really kind of get those conversations moving so that it is a group effort. We're getting the best data we possibly can. And I don't feel the need to keep rambling and keeping you guys any longer. Let's give you some time back in your day. We will follow up with the specific questions in the chat that might need some help. Please also watch for upcoming additional trainings. Things are really moving quickly here, and we've got a lot of new stuff we're excited to share with you. Stuff that um, we think the user interface is something to be even more proud of than where we are right now. We also have some work going backwards to get those earliest products, those initial IPS pre-designed reports up to speed with all the enhancements that we've made since then. So stay tuned for more information, and we'll let you know. We'll use this as a mailing list too, to let you guys know when we have some drop-in sessions scheduled.
All
Thank
right.
you
Well,
all
thank you
for
so
your time
much.
today. I'm so excited. We're working so hard on this behind the scenes, and to see so many people excited about it and interested in it is really, really cool. You turned around what's been a tough week. Thank you.
Yes, thank you all.
Take care.
Bye-bye.